Welcome to the Global Health Students and Young Professionals Summit Careers panel. I have the privilege today of being virtually joined by four incredible panelists. We have with us Dr. Hassan Merali, Assistant Professor at the Department of Pediatrics and Pediatric Emergency Medicine Physician at McMaster University. Sophie Jeffros, PhD candidate in Health Geography at McMaster University. Julia Anderson, Chief Executive Officer with CanWatch, and Lisandra Lannes, who's the International Project Manager at Unité de santé internationale at the Université de Montréal. Our session today will be moderated by Haley Mandeva, who's the founder and CEO at ThriveHire. Full bios for our panelists, as well as for our moderator, will be available on our website, and I encourage you to check those out. So without further ado, I'll turn it over to Haley to get started.
Well, thank you so much, Matt, for those introductions. As you can see, we have a ton of very accomplished global health professionals on this call. So really looking forward to an opportunity to gain some great career insights from them. So with that said, to start it off, this question is directed to everyone. Probably just in terms of logistics, it's easiest if I call on each person. Otherwise, with Zoom, we can talk over one another. But the first question is, how did you decide that you wanted to enter into global health work? Was it always part of your plan, or did it happen more organically? How about Julia? You can get us started.
Great, thank you. I'm very excited to be here, and thanks so much for the invitation. And I'm as looking forward to hearing what my colleagues on the panel say as I am to speaking, and really excited about the potential to engage online with folks when this panel is aired. So please do send questions and comments via Twitter as you're watching, and I will do my best to be online and to respond as best I can. So my entry into global health was a bit more organic, as you alluded to. So I had started my career in international development. I've always been passionate about Canada's role in the world and what it means to be a Canadian in the world, and how we can have impact and use our privilege and our position as a nation that's quite wealthy to alleviate poverty around the world and in all of its forms, and inequality in all of its forms. So I was always passionate about that. When I took a bit of a career entry into taking my master's, I was looking at what to study, and at that time the Harper government had launched the Muskoka Initiative for maternal, newborn, and child health, and I was fascinated by both the divides it was creating in civil society and the opportunity to really advance maternal, newborn, and child health and women's rights more broadly in the world. And it was sort of this contested space, and I just became fascinated. And from there, I started working with CanMNCH, that is now CanWatch, and so have gone on to the sort of into the technical side of global health at the same time as the rights-based, and thinking about, again, coming back to that root of what does Canada want to be in the world, and how do we want to show ourselves globally, and the entry point being at this point global health.
Amazing. Thanks for sharing that, Julia. How about yourself, Sophie? How did you decide that you wanted to enter into global health work?
Sure. So I think quite similarly, it was in many ways accidental. I was someone who had always engaged in a lot of LGBT health advocacy, and the thing that you realize very quickly when you're engaging in any kind of queer health is how deeply place-based it is. So even within a province or within a country, the resources and therefore the health outcomes that you see in these communities are vastly disparate between, say, the GTA or even Northern Ontario, which is one of the places I have done research in. And similarly with care work, there is sort of an increasing international recognition of the importance of supporting care work, and care is, labor that had for a long time gone unmarked and unnoted simply because it was typically gendered. It was women's work. It was what you did. And so when I got the opportunity to kind of merge the two, I ended up being able to do a lot more kind of an international focus. So currently I'm working on a research project for the International Caregiver Standard, which is a project that's being conducted by researchers in the United States, as well as we have representatives from India, mainland China, and Europe as well. So I think that what really kind of led me into this idea of global health was actually starting quite small, being sort of as a young student and even as a teenager working in LGBT health and AIDS activism, and realizing how broad that becomes and how important that becomes from an international perspective. But I started quite local and quite small, and it just kind of happened to grow from there, I suppose.
Absolutely. Thanks for sharing that insight, Sophie. Dr. Hassan Morali, how about yourself? How did you enter global health work?
I think for me, it started at a very young age. My parents are from East Africa, and so we used to go back to Tanzania when we were younger. And I'd always been interested in working with children, and then seeing the disparity with what I had as a child and what the children there had really got me interested both in pediatrics and then also in global health work. And then as I progressed through undergrad and med school, I started to do some projects where I had time. And after I finished my clinical training, I really made a commitment for that to be my career. And I pursued a global health research fellowship, as well as a master's in public health. And now I'm lucky that I'm able to do that most of my time. And like Julia, I'm very focused on maternal newborn child health. I focus on the newborn side, and I think that's so important, especially if you look at where the deaths happen and who they happen to around the world. And so I've been fortunate that I've been able to focus my time on that.
Great, thank you for sharing. And Lisandra, how did you enter global health work?
Ok. Alors, comme j'avais dit, je vais faire la présentation en français car on m'a dit que le français était sous-représenté dans cette conférence, donc c'est une belle opportunité. Donc, le fait de travailler en santé mondiale, c'est dans mon cas une question de circonstances et d'opportunités, mais surtout, je dirais, de belles rencontres. Je suis diplômée en communication et sciences politiques, en administration internationale et en développement économique. Donc, le message que je voudrais passer aujourd'hui, c'est que pour nos jeunes, en fait, c'est qu'on n'a pas nécessairement besoin d'étudier en santé mondiale pour travailler en santé mondiale et que de toute façon, actuellement, on est tous amenés à travailler de plus en plus avec des équipes multidisciplinaires dans l'ensemble de nos projets en santé. Donc, je pense que j'aurai l'occasion d'y revenir un peu plus tard quand on abordera les enjeux et les défis de la gestion de projet. Alors, pour faire court, ma carrière a débuté en communication en 2003 et les communications ont toujours été pour moi une porte d'entrée ou un tremplin pour d'autres postes, ainsi qu'une compétence vraiment très utile dans mon quotidien. Alors, j'ai navigué en milieu autochtone, dans les groupes de femmes au Québec, dans des organismes de coopération internationale, pour finalement atterrir en 2015 à l'unité de santé internationale de l'école de santé publique de l'Université de Montréal. Donc, le fil conducteur, pour moi, c'est vraiment groupe de femmes autochtones, groupe de femmes, après Gender Advisor dans le domaine du VIH-Sida à l'international, santé publique à l'international. Donc, je dirais que j'ai un passé de militante et que je fais désormais un peu plus ce que j'appelle la coopération institutionnelle. J'ai une double casquette actuellement, dans le sens que je gère à la fois des projets de développement international en santé pour l'unité de santé internationale, qui est mon unité d'attache. On touche vraiment à peu près à tout, à des projets de renforcement de capacités, des projets de renforcement des systèmes de santé, des projets en gestion hospitalière, en gestion de la qualité des services de santé, etc. Et je travaille aussi pour le Vice-rectorat aux partenariats communautaires et internationaux de l'Université de Montréal, où là, je suis amenée à travailler sur plusieurs projets de coopération interuniversitaire, donc entre diverses universités dans différents pays, francophones et autres. Et ce sont des projets multifacultaires que nous avons. Voilà.
Amazing. Thank you for sharing that. Really interesting to see how each of your career interests have evolved over time. Lisandra, I'm going to throw this next question back at you. I see you have plenty of experience in project management. What is one lesson you've learned throughout your time as a project manager?
Oui. Alors, peut-être avant de parler des leçons, je vais peut-être rapidement parler vraiment des défis actuels là auxquels on est confronté. Donc, les défis au niveau macro, on a le contexte mondial actuel. Hein. Donc, comme vous savez, la crise sanitaire liée à la pandémie de Covid-19, les problèmes de stabilité politique dans certains de nos pays d'intervention. Je pense par exemple aux manifestations qu'il y a eu en Haïti, au Liban, aux troubles qu'il y a eu au Mali, à la multiplication aussi des désastres environnementaux donc le séisme en Haïti de janvier 2012, il y a eu de récentes explosions aussi à Beyrouth, cumulées à la crise économique et financière. Donc ça, vraiment, ça fait partie des défis que nous devons relever pour poursuivre notre travail. Donc on travaille dans des états fragiles, on n'a pas d'autre choix que d'adapter notre programmation. Donc, toutes ces situations, ces impondérables peuvent avoir des répercussions sur les activités de nos projets, mais aussi sur nos équipes de projet. Ça engendre du stress, donc ça implique de revoir nos façons de travailler, les déplacements internationaux étant limités, voire totalement suspendus. Donc, par exemple, je ne sais pas moi, en développant par exemple des contenus de formation en ligne. Donc, vraiment, c'est travailler autrement pour s'adapter au contexte. Je pourrais dire aussi que dans certains cas, les problèmes d'instabilité politique peuvent engendrer aussi une suspension de l'aide bilatérale et des financements qui sont associés. Ça a été le cas, par exemple, pour le Mali. D'où l'importance, en fait, je dirais, de maintenir constamment la communication ouverte avec les bailleurs de fonds, les partenaires et les instances nationales des pays concernés. Au niveau de la gestion de projet, j'en ai parlé un petit peu dans mon introduction, c'est d'apprendre à travailler avec des équipes de plus en plus multidisciplinaires ou interdisciplinaires pour résoudre des problèmes mondiaux. Donc, par exemple, dans un projet en gestion hospitalière, on est vraiment amené à mobiliser toutes sortes d'expertises. Un autre défi que je vois moi dans mon quotidien, vraiment toujours au niveau de la gestion de projet, c'est d'arriver à trouver un équilibre entre le travail de contenu et les différents aspects de gestion. Donc très large, la gestion des ressources humaines, matérielles et financières, mais tout en restant aussi très au fait de l'actualité et puis de ce qui se fait dans le domaine de la santé en termes de bonnes pratiques. Un défi aussi, c'est de composer de plus en plus avec toutes sortes d'approches. Alors, je pense par exemple à des approches intersectionnelles, comme par exemple l'analyse différenciée selon les sexes, selon une approche intersectionnelle. Donc, suite au lancement, par exemple, de la politique d'aide internationale féministe du gouvernement du Canada en juin 2017. Donc là, vraiment, on a dû retravailler tous nos outils de gestion, comme les modèles logiques, cadres de mesure du rendement, pour répondre à cette nouvelle priorité politique. Le défi aussi d'intégrer dans notre travail l'approche d'accompagnement avec nos partenaires, donc à travers le mentorat, le coaching, en encourageant les savoirs locaux ou expérientiels et la mise sur pied de partenariats plus égalitaires en santé ou dans d'autres domaines. Donc, ne pas faire à la place d'eux. Donc, composer avec une dynamique vraiment de renforcement des capacités et de renforcement des compétences. Et puis, ça va de pair avec le défi de l'appropriation et de la pérennité des interventions. Donc, une fois que le projet est terminé, qu'est-ce qui va se passer? Alors, voilà, donc je reviens à vos leçons apprises, puis c'est des petits conseils en même temps. Je dirais c'est l'importance de la communication dans un contexte interculturel et de s'adapter à l'environnement de travail, de construire une relation basée sur la confiance avec nos équipes de projet et nos partenaires. L'importance de parler plusieurs langues aussi, ça aide. Et ce que je dis toujours à nos stagiaires, c'est que pour être bon à l'international, il faut impérativement savoir ce qui se passe au niveau local. Donc, si je travaille comme gender advisor au Malawi, il faut que je sache ce qui se passe dans les groupes de femmes au Québec et au Canada, à savoir quels sont leurs besoins, leurs revendications et puis quelles sont les bonnes pratiques ici en fait, afin de pouvoir éventuellement les transposer ou les adapter ailleurs.
Thank you for those insights, Lisandra. Julia, this next question is for you. As the interim CEO of CanWatch, on a typical day, what does your role entail? And what do you enjoy the most and also the least about being a CEO?
That's a great question. I would say a typical day, I mean, what we try to move to is lots of time and space for thinking and reflecting on strategy. So we say that management should not be about quality control, it should be about strategy control, and we're really trying to, across our organization, implement that, but it's easier said than done because the kind of relationships that are typical in the workplace between managers and their staff have been over sort of that quality and you know, watching things closely. But what we're trying to do at CanWatch is say, like, no matter where you are within the organizational structure, people are experts and people have the ability to start and end projects and to complete them. And if we give them the sort of right tools and empowerment and training, we shouldn't have to sort of sit and have that hierarchical relationship where it's like, you get it to me and then I come back to you with my comments. And what I should be offering you is, you know what, is this the most strategic use of these words in this language? Is this the most strategic use of CanWatch resources to get something out on social media versus here? Or, you know, and really working with the staff and with the team to think together rather than to manage and nitpick. So that's what I'm trying to bring. So when I look at my days, I think how much of this is the administrivia and the kind of you know, traditional management, and how much of this is where I want to be, which is in strategic thinking. The second major piece of my role is persuasion and influence. And I think, you know, I know you'll ask later, what are some of the skills that I think people should build up? And that's a huge one. I mean, learning to communicate in order to persuade and influence is one of the most, whether it's your colleagues, whether it's my team, whether it's my board of directors, or whether it's the Prime Minister of Canada, having the ability to adapt messaging and wrap what your objective is into communicate it to the audience you need to is such a critical skill. So I spend a lot of time on the phone with stakeholders and people really trying to advance the objectives that CanWatch has, which is to see a world where all women, children, and adolescents are healthy and able to thrive. And I'm crystal clear on my goal, and it's all about adapting the messaging for whomever I'm talking to, and sort of whatever interests I need to meet there. And I think that's what fills up my days. And then of course there's the boring kind of signing off. We're in the middle of an audit right now, so it's like sign my name to this and follow this train and do that kind of thing. And so those are the parts that are necessary, but I try to minimize as much as possible, and give it to team members who love doing that stuff, because there's all stripes. Just that's not my stripe.
Oh, absolutely. Hassan, I'm curious, given your work in pediatrics and child health, what emerging child health issues do you think will be gaining more and more attention in the years to come?
So one of the biggest problems that we have made quite a bit of impact on, but not enough, is newborn health. So the under 5 child deaths, if you look at them, still the biggest group in that under 5 is the first 30 days. And although we've had significant impact in the under 5 total, the percentage of newborn deaths is about 50%. So in the first 30 days, that's when half of the children under 5 die. So I think that's certainly one area and group of people we'll need to focus on continually, because we're making slow progress, although it's going forward fairly well. The other big area, and this is same with adult medicine, is non-communicable diseases. You know, for adults, it's things like heart disease and stroke, but for kids, it's really injuries. So injuries are the #1 cause of death in all countries for children over the age of 5, and for the vast majority of countries, it's over the age of 1. And so that is an area that does not get enough attention by far. I'm working with Johns Hopkins in their International Injury Research Unit on specific things like child restraints and helmets. But if you've ever been to Southeast Asia, for example, that's one of the places I work a lot, you will see one small motorcycle or scooter with an adult usually wearing a helmet, because there's laws now, and then 3 or 4 kids and perhaps a partner, and none of them have helmets. And even the helmets themselves, if they have them, they're either not strapped or they're these cap helmets that don't do very much in collisions. So I certainly see injuries as a broad category, and that includes drowning and poisoning as well, being the next major thing in child health that we'll need to focus on as a global community.
Amazing, thank you for sharing that. Sophie, I see you're a really accomplished community organizer and researcher. What advice do you have for people who are interested in health advocacy? Like, in other words, how can we actually do advocacy work well?
Sure. I do have to say, I would want to acknowledge I'm in a significantly earlier stage of my career than the rest of these distinguished panelists. I feel a little bit out of my depth, but we're gonna go through that. That's the best thing I've found in these situations, is to steer.
Oh, you're very accomplished.
So
you're very accomplished, Sophie.
that wasn't a beg for compliments, but thank you. But in terms of community organizing, so that's actually how I ended up in academia in a very weird way. I'm someone who has always been deeply engaged in politics. I come from a working class family with not a lot of academic history, but with a very strong union history. So I grew up with this idea about collective action and solving problems collectively. And one of the things, and so I was really active in sort of volunteering and organizing in high school. And one of the things I ended up doing was I ended up working with the AIDS committee in my city, which partnered usually LGBT, but in general, just younger volunteers to go and visit isolated seniors with HIV. That's a problem we're actually seeing right now in North America, are these long-term survivors of HIV who have very specific social and health concerns. They're a big focus of my research. And I don't really understand quite how it happened, but I was doing that. And then suddenly I was making presentations to city council, and suddenly I was going to these conferences and speaking about this thing that I was really passionate in. And at the same time, I was doing my undergrad. And eventually it was basically pointed out to me, you know, this is a field you could just study, Sophie. And previously, I actually intended on going to med school. I think that's really common for first generation students, is to not see research as a viable career because it's not something that's really told about to you, right? I think it's really common with first generation and non-traditional students is to say, I'm going to be a doctor, I'm going to be an engineer, I'm going to be a nurse. These are jobs I can explain to my grandma. Moving my cat again. So that's what I'm going to do, right? And that had been my intention. And I genuinely had a professor say, you know, Sophie, you're so fascinated with this issue about LGBT older adults and what it looks like to age as a queer person in all of these different places. You know, you could just study that, right? Which was a revelation to me, frankly. And so that's what I ended up doing. I ended up taking this sort of path through sort of critical gerontology, which was my master's degree. And at the same time, I was still engaging in this community organizing. And that was crucial, actually, because here's an interesting thing. If you're trying to study an isolated population, as anyone here can tell you, it's very hard because by definition, they are isolated. The way I was able to engage with LGBT older adults who are a very isolated group was because I had these pre-existing community connections, right? There was no random sampling. It was not possible, right? You were looking at snowball and cluster sampling. But having those connections with people who knew I was in it for the long haul, right? Because that's the other thing, is there are a lot of populations throughout the world who have been studied a lot, but who haven't been asked to participate a lot. You know, it's a crucial distinction that's really important, I think, to probably to all of us. And so I found that having these existing community connections and going to people and asking them, hey, what do you think I should actually be looking at here? What actually is is an issue in your life? Not what do I think might be the issue, but what's actually happening? And letting that drive my research has been really important to me, and it's what has allowed me to maintain these connections and feel like I'm doing something, right? I think that's the thing that a lot of people in graduate school really want to do and are a little bit confused going, am I doing anything at all? Am I fiddling while Rome burns? And so I think when you're doing this kind of health research globally, it's really important to approach it from the space of the people you're working with are experts in their own lives, and they are almost certainly also experts in what might help. And going from there, right, rather than taking a sort of top-down approach, has been really important to me and has been really the strongest connection I see between how I do community organizing and how I do research, because it's the same basic principle. You meet people where they are and you talk to them. And you don't really prejudge what you think is going to be the outcome of that conversation, and then you work from there. And that's kind of the connection that I've been able to make, I think.
Great point, Sophie. Yeah, certainly about the need for partnership and humility within this work. Building off that point, Julia, similar to Sophie, I know you've focused a lot on promoting equity and social justice within your work. Like for instance, before CanWatch, you were the director of human rights, equity, and accessibility with Trent University. Just building off Sophie's points, do you have any other input or insights on how to effectively work with quote unquote vulnerable populations in global health?
Yeah, I think Sophie eloquently made the relevant points. I mean, coming into partnerships, I loved what you said about being in it for the long haul. So whether you come at it from an academic perspective, from a professional perspective, like I do now, or from a community activist volunteer perspective, and those aren't boxes that are separated, have clear separation, but whatever vantage point, whatever your entry point, being clear that you're driven, you're not doing this for reasons outside of your commitment to the goal, right? And I think for me, the biggest challenge to live out this work with purpose was actually when the title matched the most closely. So when I was as Director of Human Rights at Trent University, that's a role that is essentially an ombudsperson, and it's mediating complaints. And it does not have that kind of, though, you know, it should, but it does not have that sort of grassroots organizing and building the movement around equity and equality. It's really managing risk from an institutional perspective. So I found myself at that time, I'm 38 now, so that was 5 or 6 years ago, in a senior role with a title that was like a dream title for me because it said human rights right there in my title, and not able to actualize the kind of equity work that I wanted to be doing. And that was a real lesson for me that, you know, as we kind of seek out these opportunities, I'm all for the nonlinear career path of like, you can apply principles of equity and justice seeking no matter where you are. And in fact, we don't need everyone that believes in justice and equity seeking in roles in the not-for-profit sector, or we need them across all roles in society, and I believe that. But it was just an interesting sort of learning for me that I was like in this position where it was supposed to be all about this thing, and in fact it's not what I signed up for. It was similar when I went tree planting and thought I'd be with a bunch of environmental hippies, and really found out that I was working for forestry companies and couldn't even get vegan food, and it was like, this was a big revelation. So yeah, I don't know what that reflection adds. I think to your question, Sophie covered the points. Coming with humility, working in partnership, listening, fundamentally applying listening skills and making that the basic, your entry point for any conversations you have. But yeah, I think she said it very eloquently.
Absolutely. Yeah, interesting point there, Julia, about not getting too attached to job titles. I once heard somebody say, you know, it's not about getting attached to a job title, an organization, a person, but more about a mission. And I'm certainly, I mean, we're just over halfway through this panel discussion, and I'm certainly feeling super inspired on the receiving end of this, because I can tell, you know, having that really strong social mission is definitely permeating through each of your work. Hassan, I'm curious, as a medical doctor, what is one thing that's taken up more time and energy than you thought it would have when you started your career in medicine?
So I think it'll be paperwork. If you ask any physician, you just do not expect to do so much paperwork. And the solutions that have been found for physicians to improve work actually usually just add more work in terms of filling out more boxes and things like that. But I'm very lucky in emergency medicine. We're not expected to have very detailed notes or very long patient encounters. So my paperwork is kept to a minimum. I think one of the things I'm working on now, and I think that everyone struggles with, is email. And how do we spend more time doing more important things than things like email? And I would just highly encourage anyone. This book really changed my life, I would say, and all of my academic work. It's a book by Cal Newport called Deep Work. And it's just a very simple idea of doing undistracted single tasking. And so I do this every morning, which is why this is great that it started at 11, where I don't do any email or any text messaging, and I just have whatever the most important project is for me. Right now I'm doing some AI work with helmet use, and I will just work on that one thing until 11 a.m. and that will be the time when I open up email and do other things and have to get distracted again. But having chunks of time in your day to do undistracted work is a very simple idea, very hard to do now that we all have smartphones and a million things to respond to. but I will tell people who are listening to this, I think it will really change the way you work and make you a much more productive person in whatever the most important thing you're working on is.
Oh, that's a great tip. I feel like I've got to apply that in my own work. Lisandra, I see in your current role, you work with partners all over the world, you know, including Haiti, Ivory Coast, Morocco, Lebanon, China, and Kazakhstan. What skills do you think are especially relevant when working in intercultural settings and teams?
J'irais de façon plus large les compétences générales en fait en gestion de projet. Il y a beaucoup de compétences en fait qui s'apprennent sur le tas. Hein. Tu peux suivre un cours en gestion de projet avec MS Project à l'université, mais dans la réalité, aucun de tes partenaires sur le terrain n'aura ce logiciel. Pareil pour tout ce qui concerne la gestion administrative et financière des projets, la capacité à faire un budget, des prévisions budgétaires fines, ça relève la connaissance des coûts hein, dans X ou Y pays et cela s'apprend avec le temps. Je dirais aussi la connaissance des contenus en santé, c'est bien, mais ça suffit plus de nos jours, dans le sens que les bailleurs de fonds nous demandent de plus en plus d'intégrer des axes transversaux dans nos projets, hein, comme la gouvernance, l'égalité des genres, l'environnement et le développement durable. Donc, ça implique qu'on doit aller constamment en fait, se documenter pour se mettre à la page. Puis pour tout ce qui concerne l'interculturalité, je l'avais mentionné plus tôt, hein, donc l'importance de la communication, à la fois la communication interne et externe, hein, pour la plupart maintenant aussi des projets viennent systématiquement avec des plans de communication pour chacune des activités. Puis l'importance de bâtir une relation, hein, je l'avais mentionné aussi plus tôt, basée sur la confiance avec nos équipes de projet, puis l'ensemble de nos partenaires. Puis aussi parmi, je dirais, pour finir, peut-être les compétences essentielles là, pour les jeunes qui veulent travailler à l'international, c'est de suivre l'actualité politique et internationale pour rester à l'affût en fait, de ce qui se passe et ainsi augmenter notre capacité d'influence auprès des différents bailleurs de fonds puis des partenaires. Hein. Donc, même si on travaille tous pour un seul et même bien commun, il reste que c'est quand même la course pour les subventions en général.
Thank you for that, Lisandra. Sophie, you went into this a little bit in your last response, but I'm just curious, like what factors went into your decision-making when it came to deciding to do a PhD? And so far, what have you enjoyed the most and least about your PhD studies?
Sure. I mean, the joke is always, of course, that, you know, I couldn't figure out another way I could get a job that just involved reading a lot. But that's obviously not quite true. For me, my goals have always been to accomplish things, which I know that's bland. Everyone would say that's your goal, right? But I was not someone who necessarily thought academia was going to be for me, because from my perspective, it seemed like people did a lot of talking about questions we knew the answers to, and whose answers were fundamentally political. And so I spent a lot of my time, and continue to spend a lot of my time, advocating for the political responses, right? That's always the thing, is we know the interventions that would have the biggest impact on health, even in Canada, for example. We also know that in order to implement them, that requires a political choice on behalf of various jurisdictions, right? Researchers can say again and again that the thing we might need, say, is, you know, a housing first approach to homelessness and addictions, but it's up to governments to actually implement it. So that seemed like that was actually kind of where I was going. And that was what I did a lot of in between my undergraduate and my graduate degrees. I worked for the Social Planning and Research Council, which explicitly does like public interest research for municipalities. And I also worked for a couple political parties and for the local city council as well, working on community-based research. And the thing was that it was pointed out to me that I was still essentially doing community-based research. I was just calling it something different, right? I was saying, we're doing a complete streets audit. Well, that's actually a piece of social geography. That's community-based geography. And that was essentially pointed out to me. And I realized that the research perspective does not have to be one of detachment from the political and social contexts in which these things are embedded, right? Sometimes it does, and sometimes it should be. But there are plenty of ways in which you can approach research from this sort of community and policy rooted space by choosing what you look at, right? Like, so when I began doing my research on LGBT older adults, when I wrote my master's thesis, there were 10 papers on LGBT older adults in Canada, not in Canada, LGBT older adults in caregiving in the entire world. There are now at least 11 because I wrote my thesis a couple of years ago. But it was this profoundly understudied area. And it seemed like, you know, I was hearing in my community a lot that like, we're worried, you know, we have like very serious and real concerns about medical discrimination. We have very real concerns about long-term care. These needs aren't being met. And in some cases, they're not being met because they're not being studied. You know, LGBT older adults fall out of both gerontological research and out of queer research, which tends to be focused on younger populations. And so what I've sort of tried to do with my research approach is identify things that I think are important and that aren't being looked at, likely because they fall into sort of the intersection of several fields or areas of research, right? These are more difficult things to study. And so that's actually one of the reasons why I'm really pleased to be studying health geography, which is, it's very strange. I'm getting a PhD in geography. Neither my master's nor my BA were in geography. This is simply an accident. But what that approach actually allows me to do is take this explicitly interdisciplinary place-based approach where you are encouraged to engage with the whole context of what produces health and well-being. And that's sort of what has driven me forward, is this ability to engage with problems that are real, that are not being sufficiently addressed, that have not been overstudied really, and that have these sort of broad solutions that require bringing together people from different areas of academia and from society as well. And that I think is some of the most exciting research to do, because it does feel like you're actually doing something, which I think is a really important thing for a lot of us.
Yeah, no, great point. Great reflection, Sophie, on the need to take a step back and reflect and think about, you know, what skills do you have to ultimately add value to other people, and not sticking within a box. So interesting. Thanks for sharing that. So I think we have time for about 2 or 3 more questions. We've got 10 or 15 minutes or so left. So these final questions are again for everyone. So I'll pick each of you. So again, it has an easy flow. But this first one is, you know, I'm curious, like we all think about different skills that we need in order to land an interview or get a job. But given your various experiences, what skills or attitudes do you think are critical to succeeding in a workplace once you actually arrive there? How about Lisandra, do you want to start us off? So what skills or attitudes are critical to succeeding in a workplace once you arrive there?
I haven't thought about this question. Maybe someone else can go first.
For sure. Yeah, not a problem, Lisandra. How about Hassan?
Give me a couple of minutes just to think about it.
Absolutely, Lisandra. And plus you have the...
And don't record this, please.
For sure. You have the added challenge, Lisandra, of translating. So that's a lot. But Hassan, how about yourself? Do you want to start us off?
Yeah, sure. So as I said earlier, I think the #1 skill is being able to do this undistracted work. And I think that will change any trajectory of any project you're working on. I think just to echo what Julia said earlier, I think this communication piece is probably the next most important thing. And for me, and I think for a lot of people, that involves writing and public speaking. So you're always going to be writing no matter what you do. You know, for me in my sphere, it's grants and research articles. But if you can improve your writing, then I think you'll be able to get your point across to a bigger audience and much more concisely and easier for them to understand, which I think is an incredible skill to have. I've written many research publications, but I still try to improve my writing. Right now, I'm taking a LinkedIn Learning course just on writing specifically, to get my writing to the next level. And then being able to give presentations and public speaking is also something that most people will be doing, especially in this sphere that requires a lot of advocacy work. So being able to take those opportunities as they come, practice them, get feedback. What I found really helpful recently is that most of everything is on Zoom now and a lot of it is being recorded. So I will go back and watch what I said, and then also I have my admin assistant do the same thing, and then try to improve for the next time.
Great, thanks for sharing that. Julia, how about yourself? So in addition to what you mentioned earlier with communications and building off Hassan's point, yeah, what skills or attitudes do you think are critical to succeeding in a workplace once you arrive there?
Yeah, so I'd underline everything that was just said, but in an effort to not repeat, but I really strongly agree with what was just said. In an effort not to repeat, and I don't mean to be sort of like dime store psychology or hokey about it, but the growth mentality, which, you know, everyone talks about, and there's like a million podcasts on growth mentality, which I've listened to a large number of. But I do think, you know, I've now, so in building CanWatch, I was one of the first employees hired, and then I've hired everyone else. So that means I've hired like close to 40 people over the past 4 years. And so I've got to this great privilege of watching people come into the organization and then grow into positions, which for the most part, they were all brand new positions because we were not, we formalized and then had to hire up as an organization. So when I look at the people who have just thrived in our workplace, and then I look at the people who have not, and when I think about what are the skills, some of them are the hard skills to do their job. So if they're comms, it's their ability to do, we have the most amazing comms team, it's the ability to do the hard social media, the actual technical skills. If it's metrics, it's their data skills, it's their research skills, etc. So there's the hard skills, fine. Then there's the approach you take to the workplace and the attitude that you bring in. And if you can sum it up, it's this ability to look at every sort of challenge or problem as an opportunity for growth and learning. We were a brand new baby organization. We were going to fail a lot before we succeeded. We had to take a lot of kind of like weird turns and twists in order to develop and establish ourselves. And the team members that really came in and said, like, I'm part of the solution here. I'm part of figuring out how we're going to do this right. I have few expectations of this organization that is brand new and has no infrastructure. I have very few expectations, and I'm going to, set out the objective, create the organization that I want to work in. So I'm going to be part of creating that organization that I want to work in. And if that means as the metrics person, I'm going to consult on an HR policy because this HR policy really is not where I want it to be. This is, the expense reimbursement policy. I'm going to come in and say, hey, can I have a look at that expense reimbursement policy and give you some recommendations, just some thoughts from other places I've worked, some ideas. So the person who created the expense reimbursement policy, they have to be in the mindset and the mentality that they're not offended by that. We're all trying to get to the best answer here. We're all trying to get to the best product. I'm not attached to that idea and that expense reimbursement, and I'm using that because it's kind of this benign example, but think about that policy paper that you wrote, that position that you've taken, that recommendation, and you're incredibly attached to that idea, but that idea is not mine. That idea belongs to us as a collective, and our goal is to make it as good as possible. So if you random person who's not part of this team comes in with some good ideas, I'm going to sit back, I'm going to listen, I'm going to accept those suggestions, and I'm going to think about the best ways to integrate them. So it's the courage of the person coming in from the outside that's like, this may not be my lane. I'm coming out of my lane a little bit here because I've got some great ideas. It's the courage to do that. And then it's also the courage to accept that, and to accept that, we put our ideas out into the collective space, and then the goal is to make them as good as possible. And so whatever you call that mentality, problem solving, growth mentality, humility, that is what people thrive with. And that's what I try to bring to my leadership too. It's like my ideas, because I have privilege and power in the organization, I have to put them into the atmosphere with a particular type of delicacy. And I have to reward when people say, no, Julia, that's a terrible idea. I have to be like, thank you because that took more courage because it's my idea and I have power in this organization. So that took, how can I appreciate and acknowledge the courage that took, and how can I now integrate those ideas, right? And like, it sounds so simple, but it's so hard. Like this is hard work of being human. And yeah, but I've just watched the team and been really, really grateful that the people who've been attracted to our weird little world of startup, not-for-profit organization working for social good have been those people that are attracted to those ideas, to a way of being, in addition to, you know, all the skills and hard skills that they bring.
Amazing. Yeah, so many great insights in there, Julia. Sophie, do you have anything that you wanted to add in terms of skills or attitudes that you feel are critical to succeeding in a workplace?
Sure. And yeah, actually, I do want to reiterate, so I'm not going to cover everything that was already said because I think they're all extremely important. And I do want to flag Julia's point about being open to constructive criticism, understanding that it's really important in these environments to be working together to get the best thing that you can produce collectively, and that being able to take constructive criticism and work with it and not take it as a personal attack, which is really difficult. Like, it's fundamentally a really hard thing for anyone to do, is super important. But what I do want to talk about a little bit, because I think I'm slightly closer to this position than many of my fellow panelists, is what it's like in your first week in graduate school or in a new lab or in a workplace. And I'll be perfectly honest, every academic position I've ever held, during the first week, I have called my mother in tears saying, someone has made a terrible mistake. I don't know what's happened. I should not be here. I know nothing. I am going to fail. I assume live in a cardboard box ultimately, and just spiral out into this catastrophizing. That has happened to me every single time. And so if that happens to you, that is normal. Work through it. It's gonna be fine. No one made a mistake. You're actually supposed to be there, I promise. And sort of building off that idea, which is that, you know, I think that it's really important, especially if you are in academia, which is a really hierarchical and quite a rigid environment, and which operates or can operate by some relatively antiquated rules that maybe are not the most humane or human-centric, if that's the best way to say it. And I think what's really important in that situation when you are brand new is, you know, if you're in academia, you're starting with a cohort. Make friends. You will have the same complaints and the same problems, and you can work through them together. And don't actually be afraid to ask people questions, right? People fundamentally love to talk about themselves. And in academia, people have been studying one thing for 45 years, and they would like to tell you about it for 90 minutes. You may have to not give them the full 90 minutes, but if you have a question or you don't understand something, people want to tell you things that they know, right? That's a fundamental human thing. And so trying to let go of that, you know, intense anxiety and fear about who is supposed to be here and who isn't, and what is a researcher supposed to look like, and what is an academic supposed to look like. An academic looks like literally everything now, and it's, you know, only getting more diverse by the day, and that's wonderful. So letting go of those preconceived notions of who you are supposed to be, what you are and are not allowed to think or respond with, and being able to be open to the experience, acknowledging that it's a remarkable experience that you will never again have in your life. There is no other point where you will be given 4 years to read a lot of books. And that's actually a wonderful experience for people to engage with, and enjoying that journey as you kind of make it through. And you will have a much better time, and you will likely end up producing, you know, better work, quite frankly, because you're not scared of that collaboration and that communication. And I think that's really important just to flag for, you know, new graduates in particular.
Thanks for that. Yeah, very important in terms of, yeah, that inner belief and also authenticity for sure. Lisandra, is there anything that you wanted to add in terms of skills or attitudes that are critical to succeeding in a workplace?
J'ai eu le temps de réfléchir. Donc, hormis toutes les compétences en communication qu'on a déjà soulignées à maintes reprises, je pourrais dire à nos jeunes que quand on commence un nouveau travail, c'est sûr que ça prend une certaine humilité, puis ça vraiment à tout âge, et que l'idée c'est de ne pas arriver en conquérant, de faire sa place sans empiéter sur celle des autres, et en fait plus tu montes, je dirais, dans la hiérarchie, plus tu dois apprendre à gérer toutes sortes de personnalités et de perceptions. C'est être capable d'en prendre aussi, tout en se faisant respecter. Et souvent, je repense, il y a un jour, il y il y a ma petite maman qui m'a dit qu'être intelligente, c'était une chose et qu'agir intelligemment, c'était autre chose. Alors, j'essaie d'appliquer cette devise dans mon quotidien, ce qui n'est pas toujours facile. Voilà.
Thank you for that, Lisandra. So I think in terms of time, we just have time to ask one more question. Again, this question is posed to everyone. But I wanted to touch on COVID. It's certainly a really difficult time, really challenging to enter the workforce, and also, you know, for those who are already within the global health sector, look for new opportunities and yeah, leverage different ways to build their careers in the sector. So I'm curious, what advice do you have for emerging professionals who are wanting to enter into the field during this ultimate time of uncertainty? How about Hassan? Would you like to start us off?
Sure. Yeah, I think it's a very, very challenging time for a lot of people. I think one of the things you can do is look at it from the perspective of what are people doing now, and mostly that's online work, and how can I transform my work to be more online? And I think that will be very attractive for anyone that you work with, especially new employers. So for example, right now I teach a course called Helping Babies Breathe, which is a newborn resuscitation course for low and middle income countries, and it's always been done in person. It's a small, like 6-group person class with one instructor, and there's a flip chart. It doesn't require any PowerPoint, and they're newborn simulators. And so when COVID happened, one of the things we were thinking about, not from the perspective of jobs necessarily for us, but how can we transform this so that other healthcare providers will be able to continue this important work? And so what we've been working on, some of my colleagues, is building this whole educational program to be transformed to be online. And so we've ran multiple tests on how we could do this in different countries online with simulators, and try to keep the core of the program, but do it in this time which we don't know how long it'll last. And you know, sometimes this kind of work can be really helpful. Even after COVID ends, we'll be able to reach areas that we weren't able to before. I think just thinking big picture about what are the advantages that this situation presents and what other people will be looking for is a way you can just reframe it and work on those types of things.
Yeah, no, absolutely. And great point, Hassan, about the need for online skills. Sophie, do you have anything to add to that in terms of advice for professionals who are wanting to enter into the field during COVID?
I mean, not in particular. I don't envy them. I'll say that. It's not a great time to be a new graduate. We can acknowledge that collectively. It's not a great time. But there have been many times throughout history where it has not been a great time to be a new graduate or a new researcher. And we have adapted, and that's what's really important. And I think that, you know, from my own perspective as someone who researches caregiving, this has been a really interesting time and a time full of a lot of possibilities to actually expand the scope of my research to look at. I'm currently working on a paper about how informal caregivers are modifying their care mobilities, how they travel to and from the people they provide care for, given the various states of lockdowns in different locations. There are opportunities to study things that might not otherwise get attention or funding, but things that will always be an issue, right? When we're talking about things like remote work and accessibility, that will always be an issue, and it will always be great to know how to do that. And right now, there's attention and some money to help people do these things. And so taking advantage of these things that will have broader implications down the line, I think is maybe the best spin I can put on it, aside from just genuinely empathizing that it's a really rough time, and it might be harder to get started than it would have been if you graduated 3 years ago. And that sucks a lot. And I want to acknowledge that, right? But there are opportunities, and it's a matter of figuring out how to make what you are working with work for you and your research and career, in my opinion.
Absolutely. Julia, yeah, just curious to hear your insights on what advice do you have for emerging professionals who are trying to enter into the field during COVID?
Yeah, I think this is a really interesting question because we need some research on it to validate actually who is winning and who is losing in this space. And I would think that if you're an emerging professional in the global health space, this is your moment. Like, there's a global health pandemic and we need your thinking and we need your brains and we need your action and we need you sooner rather than later to be engaged in the workforce and be engaged in kind of solving what is the biggest global challenge, climate change. It is a big global challenge that is getting a tremendous amount of attention, unlike climate change, which is a huge global challenge that doesn't get enough attention. Everyone's feeling the impacts of COVID in a more personal way across the globe. So it's getting a ton of attention. So I kind of think, you know, don't have a scarcity mentality. Like, this could be the biggest opportunity window for you. Now, I also agree with what Sophie said, because I think that the traditional mechanisms and modalities and ways of getting yourself out there and networking and engaging have dramatically shifted. And I also think there are winners and losers. So it depends which space specifically you're in. But I would encourage you to think about, to think from the framing that, man, this could actually be a big moment, a big opportunity moment for me. You know, they say more millionaires are made after financial crises than at any other time. And we don't want to become millionaires in this space. That's not our goal, likely any of our goal. But what's your what's your millionaire mindset? That's like, okay, as Sophie said, how can I take advantage of this opportunity in this moment right now? Where are the spaces where they're hiring, where they're recruiting, where they need people? And how can I accept maybe a career trajectory that wasn't exactly as I planned, but I'm going to accept a deviation and I'm going to follow the opportunity, recognizing that I can maximize what I get out of this moment right now, and that could take me, I mean, everyone has said we've had these like paths of, you know, all over the place. So what is that for you, stepping into something that's not exactly what you wanted, but could take you to weird and wonderful places that we're all expressing we sort of found ourselves in right at this moment. Yeah, so my advice would be, potentially see this as a big opportunity moment, millionaire mindset. Where can you go and how can you deviate to take advantage of the opportunities right now?
Yeah, no, adaptability is definitely key. Lisandra, do you have anything to share in terms of what advice do you have for emerging professionals who are entering the workforce during COVID?
Oui, donc en lien avec la pandémie de COVID-19, on n'a pas eu d'autre choix que d'adapter notre programmation à l'étranger. Donc, c'est sûr que ça a eu des répercussions sur les activités des projets, puis sur nos équipes de projets. J'avais parlé de stress. Puis, dans un premier temps, on a dû revoir en fait toutes nos mesures de prévention, puis équiper aussi nos équipes avec des kits coronavirus. Ça impliquait aussi, dans un second temps, de revoir nos façons de travailler. Alors, beaucoup de contenus de formation qui devaient être donnés en présentiel ont été entièrement adaptés ou revus en fait pour être donnés en ligne. Donc, ça impliquait aussi que nos partenaires puissent avoir accès à la technologie. Et en même temps, comme les déplacements internationaux sont limités ou voire suspendus, ça a permis de renforcer la mobilisation et l'expertise locale, ce qui est un très bon point pour nos projets.
Amazing. So with that said, we're wrapping up. We're just closing in on time. So thank you so much. I just want to say thank you to each of the panelists for taking time out of their very busy schedules to be with us here today. Each of you shared many great insights and tips that I'm sure will be really valuable to our listeners. So thank you so much, and really looking forward to staying in touch.
Great.